and you start the procedure by making a bend at that position, enabling it to slide on. After a couple of twists, holding tension on the wire, grab it with the hemostat, holding the wire and the bracket together until you feel the tension. Now we'll do a rotation tie. This is tying in just the distal tie wing. The motion is a vertical motion instead of horizontal. And the pigtail will go on the distal, the side that you need to hold the wire in closest to the bracket slot. Deflect the wire to the bracket as you tighten. After tightening, let go of the wire. Be sure that you make the bend at the correct position for ease of placement. Now watch my hands. I will grab onto the wire with my little fingers and then make a rotation around that stabilized wire. We'll try it again. To prevent the wires from being all over your carpet, getting into your vacuum, it is best to now put them all in one place, tying them together. Now using your pin and ligature cutter, you will cut the pigtail 2 to 3 millimeters in length. I use the pin and ligature cutter to push in the pigtail, but some will use an amalgam plugger or a ligature director instrument. Before leaving any arch, be sure to check for the distal ends. As you tie in to the brackets, oftentimes wire will come out the distal end, causing an emergency visit in the office. Now we will use the respond wire on the upper. You'll see that the distal end cutter does not cut a twisted arch wire, so we used a pin and ligature cutter. You should only use a pin and ligature cutter on wires that are smaller than 016 stainless steel, or you will damage your pin and ligature cutter. In our system, the rule for tie-in of initial wires is to use a steel ligature tie whenever the wire does not fit passively in the slot, and an elastic or power O whenever the wire does fit passively. Thus, we are not asking elastic force to move teeth, but very efficient ni-tie wire. To use the quick tie elastic placer, the lever on the plier is used to expand the elastic and to release it. When placing multiple elastics from a cane, your thumb can aid you in placing multiple elastics. Next, we will use a ligature tie from a twist mate instrument. The preformed ligature is inserted into the instrument by pulling back the lever. Inserting the ligatures is easier since one hand may be used instead of two. Again, to engage the ligature tie, insert it with the lever activated. The preformed ligature is already bent at a 30-degree angle. To remove it, you again pull back on the lever. One of the main disadvantages of this system is that the ligature ties are short on their ends and difficult to deflect out of the mouth when doing multiple ligature ties. In my office, I personally prefer using the longer ligature ties rather than the twist mates. I will show you here how I twist the hemostat or the mathau plier in my hand. Always be sure to hold your thumb or finger on the bracket as you're tightening the wire into the slot. A failure to do so would cause more bracket failure and aggravation to you and your patient. One of the common problems we see is failure to push the pigtails of your ligature ties entirely underneath the bracket. This will cause discomfort to your patient and emergency visits. To check this, be sure to run your finger over the braces after the tie-in procedure to check for sharp spots, asking your patient if they feel any sharp spots as well. Proper use of a distal end cutter is to grab onto the wire, slide the plier forward, and squeeze. One of the most common problems that we see on emergency visits is a patient coming in with a long distal end, so be sure to get it as close as possible.